Hello, beautiful people. Good afternoon from South Africa. You welcome back to my channel. My name is Olivia. If today is the first time of seeing me, thank you, and I really appreciate it. To all my numerous subscribers, my returning subscribers, I really appreciate you all. Thank you so much. So today is a very special day in this channel because we're having our very first guest speaker, and he's no other person than Dr. Kelechi. Doctor, please, can you introduce yourself to everybody?
Hi everyone, I hope you're having a good day. My name is Dr. Kelechi Eke. I'm a specialist general surgeon and I'm working here in a public hospital in South Africa.
Okay, thank you very much, doctor. We really do appreciate you. Okay, so guys, in today's video you already know what you're about to watch. It's World Breast Cancer Awareness Month, September, and I'm using this platform to bring awareness to breast cancer. Okay, that is why we have the surgeon in the house on this channel to tell us everything about breast cancer, everything you need to know, just name it. So he will try his best to explain everything to you. In case you know, fine, you're adding to your knowledge. If you don't know, here is information for you. Okay, but before we go on, we just wanted to say thank you so much to every Nigerian youth out there that is protesting for the good of our country. We see you, we love you, we appreciate you, and we're also using this platform, doctor, right?
Yes.
To say
no to police brutality,
no to SARS. Like, we want a better Nigeria. Okay, so please keep the good work, and if you're out there and you're not doing anything, please use your platform and use whatever means you can, and just let's create this awareness. Okay, we are hoping for a better Nigeria. Thank you so much. Let's jump right into the video. I'll be asking doctor questions and he will try as much as possible to answer the questions, so I could be looking down every now and then. Okay, so doctor, what is breast cancer?
Okay, so usually when we say there's cancer, it means that there is a abnormal growth of a group of cells,
Okay.
that is not regulated by the body, and they have formed a swelling or a tumor.
Okay.
So when it comes to breast cancer, is when that abnormal growth occurs in your breast, and it could be localized only in the breast, or it could spread elsewhere.
Oh, okay. It's usually a tumor.
Usually it's a tumor.
Okay. All right. So how common is breast cancer? Like, when you talk about breast cancer?
Okay, so breast cancer, we must say, is the most common cancer that affects women worldwide.
Oh, okay.
And also the most common cause of cancer-related deaths in women worldwide. And in South Africa, about 20 to 25% of all cancers are from the breast. Yes.
Interesting.
And also, we know that there are about 4.5 million people in the world currently now who are living with breast cancer. And
Wow.
every year, about 1.5 million people have breast cancer newly diagnosed. And the projection is that this year, it should be up to 1.7.
Wow.
And by 2030, we're estimating about 3.5 million people every year.
Wow. So, like, it's on the rise,
It's
kind
on
of.
the rise.
It's not coming down.
It's not coming down, unfortunately.
I don't want to go out of question, but why is it on the rise, if I might say so? What do you think?
A lot of factors first is the risk factors for breast cancer have increased. And also some other opportunistic problems like HIV have also made the diagnosis of breast cancer to come in much earlier than we anticipated to be. And also the life expectancy in most countries have increased. And with increasing age, your lifetime risk of having a breast cancer increases.
So because of like various, okay, let's say COVID can it predispose
No,
someone?
no. COVID has not been known, or actually not been studied.
Okay, it's not been studied actually.
Yes,
Yeah,
yes.
because it's just
It's a
was
new kid on the
discovered.
block.
Yeah. Oh, okay.
Yes.
So, okay, let's say the third question I have here is, how many women are affected by breast cancer, like, currently? Okay, I think you just answered that question.
Yes, I answered that question.
In 2020. And okay, then what's the recovery rates of in case someone is diagnosed of breast cancer? What's the recovery rates?
Okay, that's a good question, and it also depends on a lot of factors. It depends on if you are in a developed or less developed country, and also depend at the age at which you are diagnosed with breast cancer. The current statistics we have is that in the developed country, your 5 year survival of breast cancer, which means after 5 years of being diagnosed, your chances of being alive after 5 years is as much as 80 to 90%.
Okay.
But in Africa and less developed countries, that's about less than 40%.
Wow.
So you see there's a wide disparity in the survival rate for breast cancer.
Wow. What's the cause of breast cancer?
Okay, so breast cancer has, well, two major causes. The first one we would say is hereditary breast cancer, which means you have a genetic predisposition for breast cancer.
Okay.
And that explains about 10% of people who have breast cancer.
That's 10%?
About 10%, yeah.
Okay.
The rest of it, there is no known cause. But the only thing we know is that there are associated risk factors that can make somebody to have a higher risk of having breast cancer than others.
What are the risk factors?
Okay. So the most important risk factors is increasing age.
Oh.
The fact that you've grown older means
you're getting older, things are depleting in your body.
Not necessarily. It's because you're having a lot of exposure to hormones like your estrogen.
Okay.
Yes. So remember when we first defined cancer, we said abnormal growth of cells.
Yeah.
So the longer you have, the more cells your cells are dividing, the more your cells are dividing and are multiplying. So the likelihood of one of them becoming abnormal is higher the more your cells divide. So the more time you have, the more you're likely of developing cancers generally.
All cancers.
All cancers generally.
This is not now synonymous to breast cancer.
Not necessarily. No.
Not necessarily. Okay.
Most people say from about 50 years and above, the risk climbs up. So it goes slowly. After 50 years, you have a higher risk than someone that was in the 40s.
Okay.
But then again, we've also realized that there's no age that we could say you're safe from breast cancer. Because we've seen ages of 35, 40s, people have breast cancer. And remember, we said sometimes it could be genetic. So if you have a genetic risk factor,
you might have it
earlier than somebody else in the community.
So do you guys get to see very young people that have breast cancer?
Not as young as teenagers. Mostly we see people in their 30s who've had breast cancer. And if you work them up, you find out that most of the time they've had family members who've had breast cancers before. Okay. And then another risk factor is exposure to estrogen, which unfortunately makes women at the highest risk of having breast cancer. So they're 100 times more likely to have breast cancer than males. Estrogen. So exposure to estrogen, which will mean that your reproductive history is important. So if you had your menarche, that's the age at which you started having your period, was quite early. When we say early, less than 12 years.
Less than 12 years?
Less than 12 years. That's what we call early menarche. And then if you stopped menstruating after 55 years. So that's a wide range of exposure to estrogen. That increases your risk of stimulating your breast and increases your risk of having breast cancer. So estrogen
kind of stimulates the breast. That's what the function of that hormone.
Yes, in some parts. Also, if you have taken oral contraceptives, that also, because most of them contain estrogen, those also increases your risk factors. But after 10 years, if you stopped it, you almost come back to the general population, as if you never took contraceptive.
You never took it.
Yeah. Okay. And also people who postmenopausal and hormone replacement therapy also increase their risk of.
So people that have gone through fertility treatment, does it count? You know, some people go through repeated IVF cycles and
so you're also exposing yourself to estrogen. Wow. And also obesity, increase in adipose tissue, because your body converts some of that to estrogen. So also high fatty diets has also been a risk factor for breast cancer. Sedentary lifestyle.
Not exercising.
Guys, you must
hit the gym. Wow. I just started going to the gym, guys. Honestly, like I was getting I don't look at me like that. No. I don't look like someone that can go to the gym.
No, not that. I'm like, I like the fact you're supporting me because
honestly, with general well-being, exercising is very good.
You hear it all the time, but it's good. You ask yourself, what's the difference? Why is my breast asking me to go to the gym? But That's the honest truth. So exercising, also there's been poor association with alcohol and smoking. It's controversial, but generally we advise that you reduce your possible risk factors. Most studies are not clear cut about what it is.
Okay, so it's not clear.
It's not clear.
But it can also be.
Smoking is the one that is debatable, but alcohol has actually been found because it also increases your level of estrogen.
Okay.
Alcohol does that.
Alcohol.
Then also family history. So if you have a first degree family history, which is include your sister or your mother who had breast cancer, that also increases your risk of having breast cancer.
Breast cancer. Okay, thank you so much, doctor.
No problem.
Okay, so the next question I have for you is, what age range is mostly affected by breast cancer? Did you answer that question already?
Yeah, I think I did, but let me say it. Let me say it. So, like we said, the age that's affected with breast cancer would be ages about 50 years.
Okay.
But that's the general population. Most people can have it before.
Okay, so does breast cancer affect only females?
No, it doesn't affect only females. But like I said, females are more likely to have breast cancer. I think for every 100 breast cancer you find, one of them is a male.
Is a male?
Yes.
Have you actually
I've actually treated male patients with breast cancer.
Oh, shame. Did they make it?
No, they did. I think because they were worried. It was. I think the breast is technically smaller than that of a female.
Yeah,
so it's easy to pick it up.
The change immediately. There's a change,
yeah, and guys don't like that.
Yeah, true. Of course not. It makes them like. I mean, it's so odd.
Yes,
so yeah, it's understandable. Is there any race that is most predisposed to breast cancer?
For race, no, no. But the only thing we know is low socioeconomic status, and that's because of education. Awareness. So it's not necessary that you have a risk of having breast cancer, but your mortality of breast cancer is going to be higher because you have poor access to low education about what it is, poor access to healthcare. Yeah, but in terms of your risk for developing breast cancer, there hasn't been any association with a specific race.
Okay, all right. Maybe because there are some illnesses they will say, okay, if you're Caucasian, if you're black, or if you're white, you're much more predisposed.
You're not. Yeah. So, but what other thing we have also realized is that the black race has more aggressive breast cancer. Although you have the same risk of having it, but your breast cancer is really more aggressive. So most of the time, somebody who has a breast cancer of a different race can have it slowly, quiet for a longer month, but yours comes in and it's more
kind
aggressive.
of spreads and does easily, all those bad things.
Oh,
faster.
Bad things,
God.
yes.
Bad things. Really bad things to our body. So what are the red flags?
For breast cancer. So usually
sorry, I hope you're not too hot.
No, I'm fine.
Guys, we are in hot summer
yeah.
in South Africa here, so it's like almost 40 degrees today. So sorry,
yeah, that's fine. It's
yeah.
Okay. So the red flags would be a painless lump. Painless. Usually people think painful lump is what the problem is, but the thing is a painless lump in your breast would be the most common red flags. Painless lump that is growing progressively. That's the first sign I wanted to note. But also there are things you can examine, like see changes in your breast size, your breast color, or areas that are dimpling, looks like big, your skin is going inside, or even the nipples are not pointing the same direction, one is going inside, or the area around the nipples start to change color. Those will be warning signs of breast cancer.
Okay, I also heard something about inverted nipple.
Yes.
What about when someone has a naturally inverted nipple?
So the thing we want you to do is to know your breast.
Okay.
The important thing is to know
Very
your breast.
important, know your breast. So you're able to know, okay, so this thing is changing.
Yes, I know this is changing. I know my breast, this one naturally is bigger than the other one. My nipples are inside normally or outside normally. Do you understand? But when you start noticing, you don't have to stimulate your nipples. There's a discharge, there's bloody, then you get clear.
TMI, guys, TMI. Okay, yes. Yeah. TMI is like, of course, it's for adults. Yes.
So we'll talk about that later on, but it's essentially to know your breast. And any red flag that we thought, a lump, painless lump in your breast and skin changes, nipple changes, should worry you about underlying breast cancer.
These are the basic red flags,
yes.
okay, that things we should all look out for as females mainly. Everybody but females mainly, right?
Yes.
Since okay. So how often should females go for breast cancer screening and do self-examination?
Okay, so there are 2 screenings that you can do.
Yeah.
We have your breast self-examination, which is the one you do yourself.
Okay.
And what we advocate is that women do it every month, at least every month.
Guilty me. Okay.
At least every month. And try to make it regular, like same time of the month, usually not when you are ovulating. So you have like maybe first of the month or whenever, examine your breasts. Essentially.
So we should sorry, doctor, we should put a reminder
in your calendar, you should.
Examine my breast
I'm
today.
I'm going to be a doctor to myself today.
Okay. Guys, did you hear that? Like
yes.
Okay, yeah.
So basically what the reason for this is for you to know your breast. How your breast changes with increasing age. So you know the areas that are thicker than others, the areas that are lumpy or what. So you know your breast, know your nipples. For that we advocate once a month. Although statistically there is no difference in terms of detecting breast cancer and preventing mortality from breast cancer, but in our own setup, we usually advocate people do it for themselves.
Okay, for themselves.
And education, because every once a month, your mind goes to breast cancer questions. So it also helps you to get abreast with what is new about breast cancer, you know. So that's what we explain. That's for self breast examination. Then there's also the clinical breast examination, which is more extensive. That's the one the doctor does for you.
Yeah. And
the South African Cancer Program, yes, advocates twice a year.
From what age?
So
should this be the one that the doctor should do for you?
Usually from 40 years and
from
above.
40, okay.
Yeah, at least twice a year.
So, but the breast, sorry, the self one should be like
at any age. At any age, just for you to get into that habit of knowing your breast,
knowing yourself.
Yes.
Yeah.
Although we know that it increases anxiety, you know, because you see
it does.
wasn't there last
like
month.
That, I mean,
you know,
it's looking bigger, it's looking smaller, you know.
Yeah,
it's kind of
that kind of thing. But all in all, I advocate for it for my patients. Like, know your breast so that sometimes even if you have a lump, you can tell me the lump has been growing smaller or bigger. So you have an idea of the architecture.
At least you know when the doctor asks you a question. It's not like I don't know.
I don't know. Was it here last month? I'm not sure. You know.
I'm not sure. Yeah.
So it also helps. So that clinical breast examination usually is when you then have notice a lump in your breast, you go see a doctor. He does a proper checkup, and then he'll let you know. And then also, we in South Africa advocate for yearly mammograms. So which is an imaging of the breast. It's a low radiation X-ray to the breast. Okay. We usually start from 40 years, yearly mammogram. Then when you turn to 50, we cut it down to every 2 years, but depending on your risk.
On your risk factor.
Yeah.
Okay.
So like we're saying, so breast self-examination once a month is what we would suggest, and then twice a year you could see a doctor during your checkup to just take a look at my breast as well, doctor. And then when you're 40 and above, we recommend your mammograms. Okay. Or if you have a first-degree relative who's had breast cancer, we'll advise you to start your mammograms at least 10 years before the first diagnosis, the age of the first diagnosis of your relative.
Say like 30.
Let's say your relative was like 40 years when your mother had breast cancer, not when she died, when she was told she had breast cancer.
Not when she was told, when she had it. When she had it may be different from when she was told.
So when she said she had the lump, then 10 years further, because it takes a while for cancer to develop and want to pick it up early.
Okay. So does this thing, they said mammogram is harmful or is dangerous kind of?
Mammogram is X-rays in the breast, but it's a low radiation X-rays to the breast. And we've looked at the risk-benefit ratio of exposing yourself, because the risk of exposing yourself and the risk of you finding cancer is what you are trying to outweigh. Yes.
Exactly.
So, but what remember we said you have to start with your breast examinations, then you go to go to the doctor to examine you. If he's fine and there's nobody's worried, then you might not do a mammogram.
Okay.
But if you're after 40, we'll just do a screening mammogram for you. But it's quite low radiation, and the risk of having any cancer from that is not as high as you missing out cancer.
Missing out cancer, very well. If you feel as though you're very worried and you feel you need to get this done, just get it done.
And then also there's also another option, which is ultrasound.
Okay.
Usually for women who have below 35, whose breasts are quite dense, we prefer ultrasound as against mammogram. Then the other screening methods like MRIs, if it's equivocal, we're not necessarily actually sure of what we are finding in mammogram, we may suppose for MRI.
MRI, okay. So there's MRI of the breast. Okay. Thank you so much, doctor. I'm really learning. I really appreciate you, okay?
No problem.
So the next question says, okay, I think it basically answers it's flowing. It's flowing because this next question says, what will you do when you're worried? You've basically answered it, but you can throw more light. I can
throw more light. So like we said, when you get worried about a possibility of breast cancer, go and see your doctor. Go see your doctor and let him examine you properly, and he would possibly, if there's a lump he picks up, what he's going to do is most likely, if he thinks it's very suspicious, he will take a sample of that and go and check it if it's normal cells or it's cancer cells.
Okay, so you shouldn't don't
pray.
No, you should pray, but like don't say you're praying only. Doctor,
no.
Don't you believe in God?
I do believe in God very much.
Okay.
But go see your doctor, and as you're going, pray.
Better. Okay. That sounds way better. Doctor, but pray.
Let me first go see the
pastor.
Don't
be praying in the house.
Pastor prays for me first before I go and see the doctor. No, just go see the doctor, and on your way you pray.
On your way you pray, okay. So you heard it from the surgeon himself. Go and see your doctor. Don't go and start be having faith.
Yeah, don't go and rub funny things
or say
funny things.
It's not my portion.
Not my portion, no.
Whose portion is it? So, is there any cure for breast cancer? Is it a death sentence? And what's the role of early detection?
Okay, so breast cancer is completely curable. I think for one of the cancers we have, because the breast is outside, it's something you can easily see, and so any breast cancer has very good cure rates, and it's even any breast cancer has even not just good cure rate but good quality of life, because when it's early, we're able to conserve the breast, take out the cancer, and treat you with radiotherapy, chemotherapy. So every breast cancer saves lives, but the issue is when it becomes locally advanced, your likelihood of survival is lower, and when it's advanced, then we're just going to have to palliate you.
What do you mean by palliation?
Palliation is to make you feel comfortable. Oh, I'm sorry.
You're not talking to a medical team or what?
So palliation has to do with any treatment you give someone, not hoping for a cure, but just to support the person.
So a management. Kind
so
of.
Give you pain relief. And then if the breast is disfiguring and it's not looking well, smelling, oozing, bleeding, then we take out just that breast. But we know we're leaving cancer cells behind, but just to increase the quality of life. Put you on some chemo.
So someone that is that is palliated, do they still obviously the person is a terminal illness.
It's a terminal illness.
So it's almost certain that this cancer is going to end the person.
Yes.
So when the person is palliated, does it help?
Well, it does help, because some people who have a breast cancer, their breast is smelling. They can't go to work.
Oh my God.
Their family members don't want them around.
I just remember someone I know, a very old woman in my maternal home. Then went to visit her. It was a horrible sight.
The smell from outside.
Oh my word! Oh my word!
She can't eat. Flies are around her. So we just palliate, at least to make you wear a piece of clothes. You can go around as much as you can. Go to your gardens, carrying your grandchildren. Pain will be better. But that's That's essentially
That's
what it
it.
is.
That's as much as
We can. But that's for those who have come in very late and
very
the cancer
far.
has spread everywhere.
Oh, okay. So what are the gradings? Do you? I mean.
Okay, so we have 3 basic gradings:
Okay.
early cancer, locally advanced, and a systemic disease.
What's that?
Systemic. So early breast cancer is very small in size. It
And it
doesn't spread to the areas around the breast.
Okay.
It's only in the breast, which means that you can almost have complete cure, if that cancer is taken out.
Okay.
And then locally advanced is at the breast, but it involves structures close to the breast, where your at the armpits, ne? Yeah, armpits.
Yeah,
There's some lymph nodes that drain that are already affected, or your skin has started changing. Then we think it's locally advanced. But when it's systemic disease, is when it's gone into the bone.
So when it's late, it's like
there's nothing we can do.
There's not so much you can do. That's where you talk about the palliation,
where we only make it comfortable. If your blood level is low, we transfuse you. We give you some medications for pain and some chemotherapy just to see. Cancer shouldn't be a death sentence. That's what people fear most. When they hear cancer, they think it's a death sentence. No, it's not a death sentence. It's only a death sentence when it's advanced. You know, there are people who have cancers of the skin who get complete treatment, cancer of the thyroid, prostate cancer, and they're fine. You know, but it shouldn't be a death sentence.
So cancer shouldn't be a death sentence, okay? Don't be scared to get checked, right?
Yes, go check.
Because that's one thing that really scares people. Oh, what if they find something? Let them kuku not find them. Let me.
Yes. There's nothing wrong with saying I had breast cancer and I was cured.
Yeah.
But the bad thing is to say I had breast cancer and it was too late. And
The last question says, any advice to females and males regarding the issue of breast cancer?
Yes, this is Breast Cancer Awareness Month. My advice will be speak about breast cancer. Speak about breast cancer.
Share the word.
Share the word.
Don't be shy.
Your friends.
Don't be
Have
shy.
you examined your breast lately? And you don't have to examine the breast.
Why do you want my audience to just...
No, but you see, so don't feel bad.
I don't. I do, but it's not like I in fact, it will be safe to say I don't.
Yes, honestly. This video is for you guys.
Yes, and it's for me as well. Yes. I'm learning, and I'm learning, obviously. Yes. The point is this: try and be informed, right?
Yeah, be aware. Every month, like we said about the self-breast examination, examine your breast and find out something new about the breast. Find out.
It's not doable, but try. It's not practical. Is it?
It is practical.
Okay. It's a conscious effort now.
Yes.
When you're like, okay, I have to do this. I've not examined my breast. Honestly, I'm very guilty. I've not done this in God knows when.
Yes, all. I think that's all I have to say.
It has been very eye-opening, Doctor. Thank you so much. We really appreciate you. Thank you. We love you, and hope you're going to. If there's any other opportunity to be on the channel, you can come and
click there and subscribe.
Yes, have you subscribed? Subscribe to this channel,
and
please,
send
guys.
A comment underneath.
Yes, and very important. If you have any question, Dr. Eke will be on the comment section, right? Do you promise to be on the comment section to answer your question personally? In case you have any concerns, any questions personally, he will be there to see that, at least to the best of his knowledge, which is very vast, so he will answer you, and make sure you subscribe. I wonder why you've not subscribed. Like, seriously, if you get to this point that you've not subscribed, is it that are you sass?
Should we end you?
Should we end you? You're not sass for crying out loud, so you should have subscribed. We are just kidding, but please subscribe, and when you do, turn on the notification that looks like a bell. That's where you'll be notified whenever I post any video, or whenever we have, like, very, very knowledgeable people like this on the show. Okay, thank you. And do you have any closing words?
Yeah. It's know your breast.
Okay, know your breast. So hashtag know your breast. Thank you so much, Doctor. We appreciate you, and thank you guys for being here. We love you. Bye.
Bye.
Did you see my pink?
Oh, I forgot my pink.
You were coming on the show and
I remember this. I was
going to tell you to wear pink, but I was like, if I say maybe you run. Yeah, because it's breast cancer awareness month and it's pink. So everything on my face is pink lips, pink everything. So thank you. I had fun so much. I hope you had a lot of fun. Thank you guys. I'll see you on my next one. Bye.